It's hard to get a read on what's happening with the coronavirus in the United States these days. It seems like it's fading away, but then you look at some numbers and it looks like it's making a comeback. A lot of experts worry that we are experiencing a resurgence. So what's actually happening? The key to figuring this out is to get local and then crunch the numbers. There are all sorts of coronavirus numbers we could look at. So one good measure in our fight against coronavirus is hospitalizations. How many people are currently hospitalized with the coronavirus? That doesn't suffer from being a lagging indicator, and it's not dependent on testing as much. So how do we look on the score of hospitalizations? Like this. These are nationwide numbers. You see a sharp climb, and in mid-April, we had nearly 60,000 people hospitalized. Since then, we've had a steady drop, and now we're about half that, and it's generally a downward trend. So why are people worried? A virus like this can't be considered as a national epidemic. Spread is person to person, and so this is a local phenomenon. That means different parts of the country will have very different numbers. Now let's break them out. First, you see the Mid-Atlantic. This includes New York City and its surroundings. It has a massive spike in hospitalizations in April, and now it's been falling dramatically. The New England chart is basically a less extreme version of the same pattern. The Midwest is a slightly different pattern, but it's largely the same. A jump in April and a steady drop off since then. Here's coronavirus hospitalizations in the South. It's a plateau throughout May and then a recent spike in the beginning of June. Out west, it looks like a stubborn plateau. Now, the Southwest may be the most worrisome, hitting all-time highs in hospitalization around June 10th. This is the nature of the virus. It's a local phenomenon. There will be local outbreaks, and then there will be clusters of local outbreaks. This is one reason it's going to be really hard to snuff this virus out. When we feel we have it defeated in one place, it's flaring up in another. And this is why, if you really want to understand what's going on, you have to get local.